Hi, my name is Dr. Priyanka Chatty, and I'm a pediatric nephrology fellow at Lurie Children's Hospital in Chicago. This video will discuss a nephrotic syndrome action plan, which is a patient-centered tool that was created by several pediatric subspecialists in close partnership with the National Kidney Foundation. Nephrotic syndrome is a kidney disorder that causes your body to pass too much protein into your urine. There are tiny blood vessels in the kidneys that function as filters, clearing out waste and water into the blood. When these filters stop working correctly, too much protein can slip through these filters and get into the pee. Protein helps to hold fluids in the blood. When there is less protein in the blood, fluids can move to different parts of the body and cause swelling, particularly in your face around your eyes, feet and ankle, and belly. Most children with nephrotic syndrome respond well to a course of steroids. However, it is important to take this medication as prescribed by your physician, as well as any other immunosuppressants that you may be prescribed. Sometimes, however, a child will have a relapse. This means the nephrotic syndrome comes back after going away. If this happens, treatment will start again until the condition improves. We have developed this action plan to help you more easily keep track of the signs and symptoms of your child's nephrotic syndrome and when you should call your doctor. Let's get started. At the top of the plan, you will notice your child's name and date of birth, the date of their most recent visit, and the name of the clinical team member who completed the plan. The Nephrotic Syndrome Action Plan is divided into 3 different zones: remission, relapse, and severe relapse. You will see these delineated by the colors green, yellow, and red. The first zone is the green zone, indicating remission. This summarizes the scheduled medications that your child should take, as well as how much and how often. To the left, you will see pictures that depict a child who should generally be feeling well. Your child should be active without any cough or trouble breathing, peeing normally, have no belly pain or swelling, and have normal urine protein, indicating trace or negative. During this time, we expect our child to check their urine once a day. When the urine dipsticks indicate there has been trace or no protein for 3 consecutive days, please call the nephrology office to notify them. The next zone is the yellow zone, indicating relapse. This summarizes the signs and symptoms your child may experience, including becoming less active. To the left, you will see pictures of a child who is feeling bad. Your child may experience mild cough and congestion, have fewer voids, some belly pain, notable swelling of the feet, hands, or eyes, and a urine test that is not normal, indicating 1+ or 2+ protein. During this time, we expect your child to check their urine twice a day. If your urine dipsticks is showing 2+ or more protein for 3 consecutive days, please call your nephrologist immediately. All medications that are outlined in the green zone should be continued as prescribed unless discussed with your nephrologist. Diet restrictions at this time should be only 1 tablespoon of salt or less per day. The next zone is the red zone, indicating severe relapse. This summarizes the signs and symptoms when your child may become even less active than before. To the left, you will also notice again pictures that depict a child who is feeling worse. Your child may experience symptoms such as a fever, which would mean a temperature of 100.4 or greater, severe cough and congestion, no voiding, severe belly pain or vomiting, swelling or redness of one leg or arm in comparison to the other side, and a urine test that is not normal, indicating 3+ or 4+ protein. All medications that are outlined in the green zone should be continued as prescribed unless discussed with your nephrologist. If your urine dipsticks are showing 3+ or 4+ protein, please call your nephrologist immediately and plan to drop off a urine sample at the lab. It can be helpful to review this video periodically as a refresher when your child is feeling well. This will help you feel more confident when your child is sick. The emergency contact information for your on-call nephrologist is listed below. You should notify them of your child's emergency after initiating the previous steps in the yellow and red zone of the care plan. The second page of the action plan is an educational handout that covers several different topics that you may find helpful when caring for your child. As you know, we recommend a low sodium diet for your child. On the left side of the handout, you will find a list of foods that are high and low in sodium. It is important to pay close attention to nutrition labels when choosing different foods. In general, we recommend limiting snacks to 140 to 150 milligrams of sodium per serving and meals to 400 to 500 milligrams of sodium per serving. Your doctor may have an overall goal for your daily sodium allowance that will be outlined here as well. If you enjoy preparing meals at home, the bottom right of this handout has a QR code to scan with some ideas for quick and easy low sodium recipes. In the top right corner, you will see a QR code to scan that will take you to an informational video on nephrotic syndrome. Below this, you will find a list of vaccines that are recommended your child receive. We recommend discussing this with your primary care provider and obtaining them as soon as possible and when appropriate. On the bottom left of the handout, you will notice a weekly calendar. Under each day, there is an area to document the result of the urine dipstick, as well as a dose of steroids if and when your child is on a taper during the remission phase. We hope this video allows you to feel more comfortable with how to utilize the action plan. We hope you find it as a helpful aid in caring for your child. Please contact your child's doctor if you have any questions regarding information on this form. Thank you for watching.